Welcome to Working Effectively with an Interpreter in Healthcare. Doctors and other healthcare workers need to know how to work effectively with an interpreter. This online workshop describes the different options for helping non-English speaking patients. The goal of this workshop can be simply stated: to improve communication with patients with limited English proficiency by learning techniques for working with interpreters. It is useful to stress that working with patients with limited English proficiency through an interpreter is a skill. This training will provide practical tips to help develop these skills. Do you know if this statement is true or false? If you speak two languages, you should naturally be able to translate or interpret from one language to another. Do you know if this statement is true or false? If you speak two languages, you should naturally be able to translate or interpret from one language to another. The answer is false. Translators and interpreters need skills and special knowledge such as medical terminology and practice. Untrained bilinguals are unaware of the ethics of interpreting and the techniques involved. Inevitably, they can make mistakes, and mistakes in a healthcare setting can be serious or even fatal. Before we continue, let's get some of the basic terminology out of the way. Interpreting and translating. With medical information presented to patients in writing, it has to be in a language they can read and understand. This is called translation, the act of rendering written text from one language to another. Interpretation is the act of receiving a message in one language and sending exactly the same message in another language through a verbal exchange. Interpretation also includes body language or non-language messages. Who is an interpreter? An interpreter is an adult who is a fluent speaker of both languages in question and who is not a relative of the patient. A bilingual person who has received professional training as an interpreter. What is the job of an interpreter? It is to facilitate understanding and communications between two people who speak different languages. You need an interpreter when a patient doesn't speak English well, when a patient requests an interpreter, and if you speak the patient's language but not fluently. Post-test question number 4. When does a healthcare provider need an interpreter? When a patient requests an interpreter? When the patient doesn't speak English well? When the provider speaks the patient's language but not fluently, or all of the above? Congratulations! You have now completed the training on working effectively with an interpreter in healthcare. You will receive the results of your exam shortly. Goodbye.